Cherilyn Lee Health Show.
This is a wonderful, wonderful morning. It's great to once again join you again, Dr. Lee. And for those of you who are just tuning in, you're listening to your favorite radio show, the Cherilyn Lee Health Show. And without further ado, your favorite radio host, Dr. Cherilyn Lee.
And thank you so much, my wonderful co-host, Belinda Foster, who is also a PR specialist. And I thank you so much, Ms. Foster, for being here. We have a wonderful guest today. And, our show is all about healing and helping and ways to help our listeners to heal. And right now, with all the trauma going on in the world, and not just in the world, but with our lives in general, and a lot of past traumas, that's why we have this wonderful, distinguished international guest today, Dr. Jeffrey Benton, which Belinda is going to give you a little synopsis of his bio.
Well, we are so honored to have him on the show today on the Cherilyn Lee Health Show. Dr. Jeffrey Benton is a human potential specialist. He has spent his life learning about the human body. He's devoted years studying how to switch on the body's internal self-correcting programs to improve the human factor quotient to enable you to access your potential. Dr. Benton developed a new trauma release technique that releases aches and pains from the cellular level of the body. Please welcome Dr. Jeffrey Benton.
Why, hello there.
And thank you for being with us today, Dr. Benton. We have been knowing each other for years and wonderful seminars throughout the, seem like the world, attending. And it's just wonderful to have you now, after all this time, on as a guest to really address a topic that is so powerful in techniques. And people are ready to learn these techniques to release emotional trauma, because we know the emotions is what's really causing us to be ill. The body in itself, we have, in our thoughts, we have over 70,000 thoughts per day. And each one of those 70,000 thoughts per day are tied in a lot of times to emotions. And if it's a negative emotion, just think what we're doing to our body on a daily basis. So it is truly an honor to have you here today to address techniques to release emotional trauma.
Why, thank you so much for having me. I'm actually excited to share with you and your listeners about how my journey and how I came to this technique.
Yes.
Let me start off by sharing that in my experience, trauma is actually broken down into 3 categories. There's emotional trauma, there's physical trauma, and whenever you sort of get both of those sort of mixed together, it just causes a block in the body system. So emotional trauma, I think you're very well aware of. People witness an event, or a loved one passes away, and they feel a sense of loss, and then maybe they feel lost because of the heartfelt connection they had with this person or this event. And then I want to give you an example of a combination of both.
Thank you.
And it happens all the time. It happens when someone gets into a car accident. So let's say you're sitting in traffic, minding your own business, and you get rear-ended all of a sudden. There was no one, honked their horn, or maybe someone even did honk their horn to alert you, and you get startled, you look up, wham, you got hit.
Yes.
So you have the physical trauma of the energy being displaced from the car that hit you into your body. There's a lot of physical trauma there. Then the emotional trauma, that jerk, excuse me for the language, how come you did this to me? I'm going to be late. And you have, why me? Why now? I don't need this in my life. And you have all this emotional trauma and issues going on too. And your body has to deal with all of it.
Yes.
And a lot of times the body doesn't know how to effectively deal with all of it. And the body needs to store these energies. And if you take a look at the word emotion, if you break it down a little bit, it says E for energy and in motion. So emotions are like energy in motion. So as I'm speaking to you over the phone, you're hearing my voice. because the energy that I'm speaking is being transmitted, and you're hearing it, and your listeners are hearing it. The magic that I find is there a way to have these traumatic energies, really pass through your body? The end result is that your body has a net effect of no damage done to it. So, for example, if there's a way that you can let, when you get hit by a car, the energy just flows through you instead of your muscles tightening up in reaction to being hit. Whenever people are upset, they stop breathing, and they clench their teeth sometimes or clench their fists in rage, and their muscles store the energy.
Yes.
So later on in this program, I'm going to share with you some simple techniques to help alleviate these energies, especially in the moment when they happen. Because that's
Wonderful.
Really the most important time to really be conscious and aware is in the moment when they happen.
Yes.
And let me give you another example of a more subtle event. Let's say, you're walking and your buddy pushes you. Whenever we're teenagers and we're hanging around, but you weren't prepared for it. So there's a little physical event that you just got pushed and you got whipped around a little bit, and let's say he pushes you off the curb into the street. Nothing hit you, but there's a physical event, and then you're like, oh, that jerk, and then you gotta fight your buddy off again. Or like, let's say a balloon pops behind you. It startles you. It's that subtle. It could be that subtle as a little bit of a traumatic event because you weren't aware of it.
Yes.
It's really being about aware of your surroundings and being okay with your surroundings. And whenever we're more okay with our surroundings, then we'll be happier with our bodies and with ourselves.
Most definitely. And then we're going to get in the show itself. We're also going to be discussing emotional scars and how, from past. When we say scars, it could be an emotional scar from emotional trauma or a physical scar. They can also.
Exactly.
Yeah, but I want to let people know that you're listening to the Cherilyn Lee Health Show. If you just tuned in, we are at a new time zone now, a time hour. We are now coming on at 11 o'clock to 12:30 Pacific Standard Time. So if you just tuned in, we have a wonderful guest today, Dr. Jeffrey Benton, and we're speaking on techniques to release emotional trauma. And I want to thank you again. I just can't say enough for having you here today because there's so much happening, and I deal with a lot of trauma, as we know, with different conditions with people. So we want to definitely go deeper into this. So I'm going to let you go ahead and continue now. So when a person enters your office, you probably do a lot of the same things. We kind of work a lot of the same, except I'm not a chiropractor, and dealing with the emotion part, because that's the whole component of a person, is dealing with the emotion, the physical, in order to get a person healing properly. So a lot of times you just spoke on the emotional and some of the physical, and we're going to go a little bit deeper now, maybe start talking on a little bit of those emotional scars.
Okay. Well, let me backtrack a moment. When someone walks into the office, they get a typical workup, and I usually deal with the structure, the physical aspect first.
Yes.
So I do a lot of muscle testing, and I don't know if your listeners know what that is, but we want to make sure that I lay a person face up and face down, and I take their leg muscles and their arm muscles, and I want to see if they have a nice strong lock to them. And it's not a matter of how strong they are. It's a matter of if their muscles have a consistency where I can push on it and the muscles lock. And there's a number of factors. One, if the tissue is injured in that area, it won't lock. If a patient is dehydrated, the muscles won't lock.
Now, let's
It
give
won't have.
people a visual picture because we are on the radio and our listening audience or listening at work and at home. So let's give them a visual picture. Lying on the table, and then you have them to extend their arm upward, right?
That's correct.
Okay, so we want to give them a visual picture because if they're somewhere, and they can go back and listen to this show and maybe have someone to even kind of do this technique with them. And so they're lying on their back and you stretch the arm straight up.
Okay.
Okay?
So, okay, great. So you're lying on your back, and you have your, and let's say it's your left arm. Your left arm is outstretched, straight up. And the instruction I give you is, I want you to pretend that your arm is like a flagpole. A flagpole just sticks straight out. Because a lot of times the patient will maybe try to resist my pressure. But I really just want the arm to be straight up and act as a flagpole. I will take my hand, my open hand, and I will place it by the wrist, and I'm gently going to increase the pressure. And it's important because it's not a quick, sudden burst. It's a gentle increase of pressure, and and then if it was like a flagpole, you'll feel some resistance to it.
Okay, so
you'll feel that
you
it's hard.
again, for the sake of the visual picture, so you're going to take your hand, place it behind the wrist, like you're going to grab the wrist, and you're going to try to force it downward. Is this
I'm going to
what
try
you're
to
saying?
push it down towards their feet.
And they're going to try to resist you, but not like a contest, right?
Yeah, but they're not going to try to resist me pushing up towards the head. They're just going to keep resisting me by holding straight out.
Yes. Okay.
Straight out. Yeah. Okay. And then for example, if that arm and shoulder complex everything's working fine, then it should be a nice, strong lock. I should not be able to budge that shoulder maybe an inch. Maybe I can move it an inch, and then the muscles lock nicely, and it's very comfortable for the patient to hold, and I can't budge it more than about an inch.
Okay,
That's a
very
nice,
good.
strong lock.
Okay.
Now, I notice that a lot of patients don't have that when they first come in, and a lot of times it's because they're dehydrated.
What a nice, simple way to test dehydration without doing a body composition analysis testing. I think that's really great and simple.
It's really simple. And the way I test it is I can have the patient either standing or laying down, and I test both arms straight out. Because if one is strong and one is weak, then it tells me that, okay, they're not dehydrated, but one side of the body needs some attention because it's not holding strong. But if both shoulders are weak, then I say you need to drink some water.
Okay. So it doesn't make a difference whether it's the right arm or left arm
No,
or
it
both
doesn't.
arms? It doesn't? Okay.
No.
So the information will be the same regardless, right arm or left arm. Okay.
Right. Okay. Yeah, so when a person first comes in, I will want to check their arm strength, both in front of them, and then they have their arms to their side. So I guess for the visual, if they're lying on the table, instead of bringing their arm up in front of them, they would just bring their arm out to the side.
Yes.
And then I'll also have them turn their head right and left and see if just turning their head makes a strong muscle, for example, a strong arm muscle test, maybe it'll go weak, and it'll tell me that there's some irritation of the nerves in the neck. That upon rotation, it disrupts the neural pathway, and the arm goes weak.
Okay. Well, let's just say that again because, again, I just want people to get a good visual picture because this is a very important show today on these techniques.
Okay. Do you want to reiterate that?
Well, you're lying flat on the table. You know how you would go and you're in the snow? I kind of see that where people lie there and they take their arms going back and forth, lying on their back. So you're saying the arm is out to the side, and then you're doing what to the arm? You're trying to move it back in toward the body, or
Yeah.
pull it out away from the body?
No, for example, that's a great picture. I tell you. So someone's in the snow making a snow angel with their
Yes.
arms and then the legs. That is a perfect visual picture.
Thank
So
you.
they will take their arms to the side, and then I will take my hand, place it at their wrist, and gently add pressure, and they should be able to hold comfortably against me. And I'll try to push their arm back down towards their body.
Yeah, because right now what we're doing is techniques for physical pain, right?
Yeah, this is actually the techniques I do just when the patient comes in. I want to see what muscles are turned on and what muscle groups are turned off.
Okay.
Excuse me, let me get a little water. Thank you. So that's one of the processes that I do with patients when they first come in to evaluate them. And let's see. So let me share with you a little bit more about how I came to develop this technique. Is that okay?
Most definitely.
So I came to develop this technique because I was dating, I consider to be a soulmate of mine, and we were just not getting along, and we were broken up, and I was heartbroken. And at that time, I was a licensed chiropractor, and I was going to the Kabbalah Center, and I cried out to God, and I really followed some of the teachings of the Kabbalah, and I got some insights. And the purpose was for, obviously there's definitely emotional trauma between her and me, and there's might have been some physical trauma. Just rushing out the door, slamming the door, and hearing the sounds. So I wanted to reconnect with her, but I knew that I needed to clear out these old emotional traumas that I have with her and she has with me for us to reconnect.
Yes.
So there was a portion of my life back then when I was really not grounded. I was really meditating, and I got to some higher consciousness realms, and I saw these insights, and these insights allowed me sort of to put together different healing techniques that I've learned along the way, but I saw how they fit together better. And as a result of a few different techniques fitting together better, and it works real effectively, and almost magically. One of the very first people that I worked with, she was date raped. And she never told me she was date raped. But whenever I was working with her, I held onto her leg, and I go, what happened here? So something off with the energy of this leg. And then she sort of broke down a little bit and go, well, that's where he grabbed me. I go, well, what do you mean? And then she shared that she was date raped. Okay, and then we cleared that energy off of her.
Now, how did you clear the energy? And you said her leg, so was it was just the part where he grabbed her? Because I had a situation, I like to interject real quick, is a person who had bone cancer. And in the process of having bone cancer, I asked her, because I do a little differently, what was the purpose? Put your hand there. Let's just meditate and ask what was the purpose of this pain and the cancer in your hip and in your neck. And they told me that their boyfriend was a karate person and actually hit them. Physically beat them up and hit them and stumped their body. And that's where the cancer started. And they refused to let go. They were so angry. They said, I'll never forgive that person. I hate that person. So because of the hatred, this is where it settled in the body. And it sounded like the same thing you're saying almost with the person who was date raped, but she knew it settled right there in her leg. And was it her leg, her thigh, where the person grabbed her? So how did you go about then releasing this so that she could overcome?
Well, I tell you, you touched on a very important point, and I'm so glad you did. And the difference, she was willing to allow me to go help her through the process of letting go and forgiveness. And I
Yes.
tell you, forgiveness is a very important, a vital component of this work and of all healing work. And it really contrasts where if your cancer patient was unwilling to forgive, they can't let go. They will not allow, and you have free will. They won't let go, then the cancer or this disease stays with you. I mean, we've had some friends, some close friends pass away, and my wife, who is a very spiritual person, had a sense. Actually, at our wedding night, we had a friend, and she was going through cancer, and she came to the wedding, and my wife had the insight to tell her, look, you just need to let go, and you need to forgive. And this friend couldn't do it, just wouldn't
No,
allow himself to
some
go
people
there.
are not. They're not going to let go. We're going to both be working with a lady who, unfortunately, something happened to her with a 28-year partner. Not even a
Yeah,
partner. She just worked for her.
yeah,
And this lady set up actually a different terminal at their house and stole all her money.
you know,
And she says she's just not going to forgive her. I'm not going to, this is new, to just happen to the point I'm telling her, you're going to have to find a way. It doesn't excuse the act, what she did. It
exactly.
does not excuse it. And you need to do what you need to do, but you have to forgive her. You're going to have
Right.
to let
Let me,
eventually.
if I completely agree. If I may, let me read to you and your listeners a definition that I have in the office
Yes.
of forgiveness. Forgive. The original intent of the word forgive does not mean to accept or condone, but to relinquish, as in, I no longer wish to hold on to this. It does not belong to me. I wish to give it back.
Yes.
Give it back to your higher self. Transmute it to the light and give it back to God, who is much bigger than we are and who is very happy to take it from you. So I have this, and I bring it up whenever I need to bring it up to show patients and clients. We are not condoning that this person shouldn't be held responsible. This person did a horrible thing, but it's actually for our own sake to forgive, to be able to let go. And it is just so important. So the person who I worked on, I helped her let go. But she was willing. So she is a willing participant in healing, and the healing has to have a component of forgiveness to it. So and I'll tell you, a lot of the magic of the work I do is really acknowledging with an open heart, acknowledging the pain. Is about 80% of the work right then and there.
Almost
So,
definitely. I know because we do a lot of the same work, a little different technique, but
right.
it's so powerful when you see this. And even within ourselves, I read something too, and I thought it was so powerful on forgiveness. Unforgiveness is like me drinking poison and hoping you would drop dead.
That's
Hmm.
deep.
I mean, I read
Wow.
that and I'm
That's
like, that's pretty powerful.
But that's not forgiveness, though. For me, drinking poison and hoping that you drop dead is...
No, no, no. I'm saying unforgiveness. Unforgiveness.
Oh, okay.
Yeah, unforgiveness is so I would drink poison and hoping you would drop dead. That's unforgiveness.
hmm
Unforgiveness, yes.
Unforgiveness.
Okay.
I
But
might
the
have stated that
opposite.
the wrong way. Yeah, just totally opposite. And people
Okay.
just don't understand that that doesn't happen.
When
It's...
you think about unforgiveness, you ask yourself, like, why would someone not forgive someone else? And especially in relation to relationships, when there are deep relationships, whether it be a dating situation or a marriage or a friendship, sometimes people hold on to, if things don't go well, they'll hold on to the pain as a means of holding on to what's left that's the only thing that's left of the relationship. Would you even say? But the unfortunate thing is, as we're talking about here, is that this emotion, this non-forgiveness, settles into the body and comes out in adverse ways. So as you said, it's like hurting ourselves in a way.
It absolutely comes out in adverse ways.
Mm-hmm.
I mean, absolutely. I mean, I think Cherilyn Miss has a book talking about different ways, the body will manifest things. I referred to a chart that was developed by Scott Walker, the NET, and that's short for Neuro Emotional Technique Master Chart. And I found it to be a very good tool to help people sort of visualize of what happens to these traumas. You can see a copy of this chart. I have it on my website, lighttHC.com. Go there, and then go to services, and then it says emotional trauma, and there's an article, a little article I wrote, and in there's a picture of this chart. And this chart is an amazing piece of technology. Let me explain it to you. Do you have it up in front of you?
We have people listening, so I don't know.
You don't?
Why don't
Okay,
you give the website out again? And is it Light, L-I-G-H-T?
Yes, Light, L-I-G-H-T.
Yeah, I want to make sure it's nice and clear so people can hear
the
website.
Okay, so Light, L-I-G-H-T, T-H-C, and that's short for Light Touch Healing Center, not the other THC. But Light, L-I-G-H-T, T-H-C.com. And then from the home page, go to Services, and then from there there's a drop-down menu to Emotional Trauma Release. And then from there they'll find an article, and halfway through that article is a picture of a simplified version of the NET Master Chart. And I find this chart, and I learned about this when I was in chiropractic college, and it was an amazing piece of, I call it piece of technology. And on this chart, on the left-hand column, part of the left-hand column, it talks about different sequences, and it has letters like T8, T10, T12, T5, T1, T4, L5, and these are different spinal levels, different levels in the spine. So that's where it sort of acknowledges where chiropractic and chiropractic spinal levels come in.
Yeah, and so I want to just sort of back up, if you don't mind, since
Sure.
you're speaking on the spine. And actually, if a person were to feel the back of their neck, and right at the back of the neck is a bulge. When you go down your spine from the top of your head, there's a little bulge there, and that would be C7, correct? So C7 is cervical spine. So
That's
if
correct.
you go from the one underneath there, you go all the way down, and that would be T, which is thoracic, and that goes all the way down to 12. If you count 12 bones or the processes that are sticking out, you can actually kind of feel those yourself. And then that's your thoracic spine. And then you go to L, which is lumbar, and that would be near the middle of the waist almost. And there are 5 bones there, or five vertebrae that you can feel kind of sticking out. Because a lot of people say, oh, I have a problem with T1, T2, and I don't want to throw that out there. And people try to figure out, where are we? Because we're on the air, I want you to visualize this, because each one of those vertebrae in your spine is also attached like meridians to different
They are connected. Yeah.
We're all connected. So you have meridians, and if you want to, kind of explain a little bit, Dr. Benton, what meridians are to our listening audience, because each one of those vertebrae in your spine is very important, and each one has an emotional link also.
Yes, they do. Boy. And so, should I explain what meridians are?
Yeah, sort of give
Okay.
them a little idea of what meridians are, because I deal with meridians in itself. The word meridian, regardless if you're using the spine, if you're using dental, because I talk about dental meridians, acupuncture you hear the word a lot, meridians, because they do the acupuncture, either hand or whole body acupuncture. But I'm going to have you to explain it for our listening audience. Thank you.
Sure. So let me explain it with using an analogy.
Thank you.
So, and so whenever we're going to talk about telephones as the analogy. So, so we have in the old days we had landlines. Therefore, there's a hard wire. There's a hard wire from one telephone to another telephone. Nowadays, we can either use a landline or a cell phone. Cell phones don't use wires. Cell phones use the airwaves. So in the body, there's two different ways to help the body communicate. It's a few ways, but I'm going to highlight two of them. So our nerves are like the landlines. Our nerves, which go from the brain down the spinal cord, exit the spinal cord at these specific levels that you just mentioned, the cervical, thoracic, lumbar, and it goes to every muscle and every organ in the body to give it nerve power. And the meridians are like a cell phone because there's no physical line, but these meridians are energy circuits.
Yes.
That you can tap into, and you manipulate these energy circuits to balance different energies of the body. And that's what the meridians are. They're energy circuits, and maybe you can explain a little bit more to your listeners. But you can see how to help the body work well, you need to have a balanced nervous system and a balanced meridian system. And then nutrition and emotions and hydration, it all ties in together. But that's how I sort of explain to someone what the meridian system is, because you can't see it. You can definitely feel it, and you can definitely feel it whenever there's a block in the meridian system, because you can feel a point of pain on the skin. You rub a certain point, and acupuncturists and the Chinese developed this whole system of meridian therapy. You can actually find a spot on the hand or on the foot or anywhere in the body where there's a pain, and that's a place on the meridian circuit that the energy is not flowing well. And then
Yes.
it's the purpose of the healer or the acupuncturist in particular to understand why the blockage is there and help clear it out.
Yes, and the same thing with reflexology also. And this is
Oh,
using
absolutely.
the feet, every landmark on your feet and your toes and underneath your toes and on top of your foot all have landmark for the rest of the whole body, which is really important. But for the sake of this show, and if you're just tuning in to the Cherilyn Lee Health Show with my co-host, Belinda Foster, and my guest today, Dr. Benton, Dr. Jeffrey Benton, and our topic today is techniques to help release emotional trauma. Because like I said, right now, there's a lot going on, and people are holding on to so much. So we want to really get into the techniques, too, and so people can start learning how to do this. And I do want to say on June 2nd? Which is a Saturday? No, June 8th.
June 15, I thought we said.
June 15th, we're going to have Dr. Jeffrey Benton at our clinic here at NutriMed Integrated Healthcare. And you can call us at 310-419-4300. And we're going to be going through some of these techniques with different people. So you're more than welcome. I know some people are in different states, but we will be videotaping this and putting it up so that you will be able to see these techniques yourself.
Oh, that is so exciting. And for those of you who are listening in and would like to write in a question, feel free to email innerlightradio@yahoo.com. And to call in, please call 310-928-7733.
And again, give that number again if they want to call in and they have a question.
Absolutely. For those of you who are listening in to the Cherilyn Lee Health Show on Innerlight Radio, please feel free to call in with your questions to area code 310-928-7733. And we look forward to hearing from you.
Yes, and you can always call us at the clinic at 310-419-4300, and we'll give you the time that we're going, because we will need to RSVP for June 15th, which
15.
is a Saturday. And
Wonderful.
parking is free, guys. Parking is free.
All right.
So we're going to have a wonderful day. But for the sake of the show today, I want Dr. Benton to get into some of the techniques. Maybe we can start with, I don't know if you want to start with different type of traumas, emotional trauma, which is always going to settle in the body as a physical trauma. So I'm going to let you go ahead and get into these wonderful techniques so people can start doing some of these at home.
Okay, shall do. So let me finish explaining this chart, because the chart actually has
Yes.
some of these techniques built in. So we described a little bit of the spinal levels.
Yes.
That this chart has, and then if you read across the top of the chart, it talks about exactly the acupuncture meridians, but also the 5-element law. And the 5-element law is a broader scope of looking at the body through 5 elements: the earth element, metal element, water element, wood, and fire. So there's a 5-element law, and then acupuncturists know how the 5-element law ties in with the meridian systems. And, for example, the water element has a yin and yang. And so the yin and yang in the body is sort of like and I apologize if I get technical. Whenever we have the fight or flight or the relaxed mode, whenever we're running and we're very active, we're more yang. We are more sympathetic dominant. Whenever we were relaxed and whenever we're sleeping, we are in yin mode, and that is whenever our body's in parasympathetic dominant. And the body needs to have times when it's really active, which is yang, and whenever it is not as active. And different processes go on in the body during these different events. For example, if we should be digesting our food when it's a quiet time. So whenever the body is in the parasympathetic dominant, in yin mode, that's whenever the brain sends signals to our stomach and our intestines to secrete all the enzymes to break the food down.
So would you say a person shouldn't be eating while they're watching a basketball game?
Probably not. And they shouldn't be eating to whenever they're watching a basketball game, because a basketball game is very stimulating. And having a stimulated body means that the body can't relax to produce the enzymes, which, by the way, is one important reason why people a lot of times will get heartburn or get indigestion whenever they're eating quickly or eating when they're not relaxed, because the body's not designed to release the enzymes until you're relaxed. And the one big reason to give patients, if they're on the run, enzymes orally, because to help supplement the body, because they're rushing too far. Of course, the pharmaceutical industry will give you things to coat the stomach, which is saying, oh, you have heartburn because you have excess stomach acid. But in my experience, that's not the case. The case is the body doesn't produce any enzymes and any acid, and the food that you've just eaten, it sort of starts rotting in your belly because you ate very fast and you rushed out the door to your next appointment or wherever you had to go, and your body isn't in the right mode to secrete the enzymes and the acids the body needs.
Yes.
So, a little aside. Okay, so
that's okay.
But I want to sort of get back, so I wanted to explain what yin and yang is, because if we look at the water element, the yang portion is the bladder. The bladder is, and we know that the bladder deals with the water in the body, it stores water. And the yin portion of the water element is the kidney. So, for example, the kidney and the bladder make up the yin-yang of the water element. Now, the what else is in this chart is the chart actually lists emotions that reside with the kidney and the bladder. For example, the emotion that most often is associated with the kidney is fear, and the emotion that's most often associated with the bladder is paralyzed will.
Now say that again, please.
Yes, sure. So the emotion that is mostly associated with kidney is fear, and the emotion that's mostly associated with the bladder is paralyzed will.
Now give an example of that, please.
Perfect example, when someone says, he was so scared, he pissed in his pants.
Okay.
Such a tremendous fear happened, he lost bladder control, which is part of the water element, because the emotion was just so overwhelming fear.
Yes. Not to cut you off, but we do have a caller. Caller, can you state your name and where you're calling from? And thank you in advance for calling.
Yes, hi. My name is Devonay Unleashed, and I'm listening to your show. Dr. Cherilyn Lee is very interesting. And what caught my ear the most in the last few seconds was the doctor saying that you shouldn't eat while watching basketball. Now, did you hear me?
Yes, I did.
Okay. Now, it may be a true thing, but is there something that we can do? Because, sports fans are going to eat popcorn, we're going to have some hot dogs, we're going to have some burger. We're going to eat things while we're watching the game. Could it be possible, doctor, that we eat something that is less, something maybe like some broccoli or some carrot sticks that would be better for eating while watching the game?
Probably taking an enzyme while you're watching the game. Wouldn't you say, Dr. Benton? Just taking your enzyme.
Definitely taking some enzymes. And I'll tell you, eating healthy foods,
Yes.
healthy foods that are natural, they already have enzymes inside them. So
Yes.
natural things like broccoli and carrots are better than eating potato chips and
Most definitely.
during an active basketball game.
Well, we're going to have to spread that all over the world because I don't know anyone that doesn't eat unhealthy
Chips
stuff while they're
No,
watching games.
Yeah, because I know they call out for pizza and everything else.
Yes,
So
exactly. Pizza is the number one food that people like to eat while watching sports. So I will definitely be promoting that, to eat very healthy while watching the games. Is that a tendency to have, like you said, heartburn or maybe even a heart attack or stroke?
Well,
or heartburn. I don't know about a heart attack or stroke from eating.
heartburn and indigestion is more what you'll see after eating too fast or eating whenever you're watching a sports event where things are really active.
Okay.
Because you're involved in that game, and you're not even thinking about chewing. It's just like the food was there in front of you. Now the food is gone, and you're watching the game.
And I get so excited in my games that I don't even know if I swallow. So I think it goes down my throat, but I'm not sure.
It's gone. It's no longer sitting in front of your face anymore.
Exactly. Thank you so very much. I love the show.
Thank you so much. Continue to listen.
Thank you.
Thank you.
Thank you.
Well, Dr. Lee, it looks like we're going to have to cancel that NBA party we were planning. No, I'm just kidding. We don't have one. With the nachos, I'm kidding. We don't have that.
Well, we'll just have to tone it down a bit. Eat first and then watch the game after. We can do that.
Afterwards.
And then
we can do that.
drink your water.
Definitely drink our water.
Don't
A
mean to
water
stop.
party.
Yes, so we can have our bladders and kidneys functioning properly. Let you go ahead, doctor, with the free. That's interesting fear, because you have a lot of people who said they're fearful to stand in front of people, and they have fear of this, fear of that. It's just a lot going on, especially in today's world with fear. And it's interesting you said that, because I've had, within the last couple of weeks, more people coming in with kidney problems.
Okay. So,
yeah.
Right. So one thing to ask them is, what's very fearful in your life, or what happened? Did something happen, a day or two, or maybe up to a week prior to
Yes.
you having this kidney bladder issue. Okay. So then, and then let's look at another set of organs in the body. On this chart, it says liver and gallbladder. Liver and gallbladder are the yin and yang components of the wood element. And the emotion mostly associated with the liver is anger, and the gallbladder, the emotion mostly associated with the gallbladder is resentment. And an example is, the gall of that person. If someone's describing the gall, they're describing, and if you look at what color is gall, what color is like bile in your experience, or what color sort of conjures up in your mind when you say, anger and gall of somebody.
Yes.
It's like a putrid green is what I get.
No, same here.
Okay. So now what this chart does, it sort of marries three different healing disciplines together. So it marries the world of chiropractic spinal levels, it marries acupuncture meridians, and ties it in with different emotions. And when I learned about this, it was really fascinating. And I had a healing journey on my own right before I was going to chiropractic school. I was graduating from Cal State Northridge with my degree, and I wanted to drive cross country. Excuse me, hold on a second while I grab a little water. Okay, thank you. I wanted to drive cross country, and I didn't want to start paying my student loans back. So I added a minor. So I had to take an additional class, and I signed up for the new National Student Exchange Program. So I drove out to Kentucky, and I took my additional classes there to add my minor. And when I was driving, and since I was driving cross country, I took everything in my car with me, and I actually took skis. So on the way back from university, I can stop off in Colorado and ski some of these famous mountains. And whenever I got to Murray State University and went to school there, my knees started hurting. And I was like 20, in my mid-20s. But they were hurting something fierce. They were hurting something like an 80-year-old man, like I was hobbling up and down the stairs. And It really scared me. I go, what is going on that my knees are hurting this bad? And I actually saw a chiropractor out in Murray State, and it got me around 75 to 80% better. But it wasn't until I was in chiropractic college, and Dr. Walker came on campus and did a seminar for the students at my alma mater, Los Angeles College of Chiropractic. And then afterwards, an associate and I were workshopping this technique in the clinic. And he did this muscle test to me. So I held my arm out, and he held on to it. And it was a strong arm, so that means a strong arm tells me that you can use it to test other parts of the body. So whenever you have a strong muscle, that means that part of the body is intact, and then I can actually use the muscle as a meter. And so what he did is he held my arm and he touched my knee. He touched one of my knees, and my arm went weak.
Yes.
And that tells me that something is in my knee, and it's out of place, and it sends this neurological feedback loop to my brain, to my arm, and my arm goes weak. And it was actually an emotion. It was an emotion tied into my body.
Yes.
But it wasn't even my emotion. I'll tell you, this is what really just beyond impressed me. It was an emotion that came from my father's side of the family. It was handed down to me. But it wasn't even really my father's, but it was my father's side of the family. And the example to help explain this to you and to your readers, remember the famous story of Romeo and Juliet. What happened was, you had a feud between these famous families, the Montagues and the Capulets. Generations ago, someone got upset with somebody else, and a feud erupted. And for generations, the families were battling with each other, until we came to Romeo and Juliet, who fell in love with each other, even though they were from two different families. And then, the fabled story, how they had to be with each other, and they died at the end of the story. Tragic. And the energy of that hatred of this feuding families was handed down generation to generation. Whatever it was, some energy through my father's side of the family was handed down to me, and when it was finally acknowledged, and then we found out what energy it was, and I think it was some anger, resentment, and then he tapped me on the spinal levels while I thought about this event and held certain contacts, and I took a deep breath in and a breath out. It was the first time in 2.5 years or 3 years that my knees felt 100%. I couldn't believe how good and powerful my knees and my legs felt after that session.
Amazing.
Outstanding. It was amazing. Just amazing, outstanding. And that's like my own, I go, wow, this stuff is amazing. So now, and that was just talking about emotions. So now what I'm sharing with you and your listeners is not, because emotional trauma is really emotions and physical trauma like we talked about before. And so let's talk about the physical trauma, because it's almost equally as important.
Yes, it is.
And I'm going to tell you and your listeners a real easy way how to clear it. It's fascinating.
Wonderful.
I learned this technique by attending one of Dr. Wally Schmidt's seminars, and he learned it from a podiatrist years earlier.
Amazing. Yeah, I've taken
amazing.
his classes. Mm-hmm.
And this technique, well, let me tell you about, I guess, how physical trauma sort of gets stuck in your body. So what happens to you when you're startled? Someone pushes you or a balloon pops from behind you.
Yes.
Two main things happen. You stop breathing and you look up. So if you look up and you stop breathing. And what we have to do is you have to think of the event, and you have to look up and you have to breathe. You have to unwind what was wound up. It's like that simple, and it's that profound. So,
and I hate to say this again, but we do have another caller. So can you hold that, Dr. Benton?
Sure.
Caller, can you please state your name and where you're calling from? And thank you in advance for calling.
Yes, my name is Lynn. I'm calling from the Light Touch Healing Center.
Yes.
Hi, and I just wanted to say I'm such a fan of the show. I'm so glad Dr. Benton is actually speaking today about something that, a lot of people are not familiar in regards to how your emotions actually tie into your physical pain. So I was sitting here at the office, and, I remember we had a patient who left just this beautiful letter for us that basically, consisted of how those things tie in together. And if you don't mind, I'd like to read it so the patient
can
please
do. Please do.
Okay. So it says, I had constant pain in 3 areas: the left side of my neck, the left shoulder, and right in the center of my back. And at work, I was involved in 3 major projects, and no matter how hard I worked, they were on the edge of failure. Spiritually, I felt dark and full of anxiety. I sensed that I was going through a trial that had first made itself apparent to me many years ago, and now, although the circumstances were different, the experience was the same. I was faced with these dark feelings of failure that were engulfing me. I had to admit that after 3 sessions with Dr. Benton, the darkness within me was gone and light replaced it. The pain in my back, shoulder, and neck was greatly reduced. I felt that a problem was in the process of transformation. It is true that the projects did not come into fruition. However, within those 3 days, all projects were transformed and renewed and are now on the path of completion. I continued to work with Dr. Benton on another problem I was faced with, and again, I had a large block of darkness and disorganization within myself. Surprisingly, it took the form of a black piano and a previous girlfriend from my grammar school days. Dr. Benton's efforts transformed the darkness into light and the disorganization into order. Dr. Benton has a talent and a skill to help people resolve their conflicts and resolve their pain. So, this kind of really relates how when you're feeling something inside, it will express itself physically.
It will. Yes.
Without yourself acknowledging that, you know what, hey, maybe my back hurts because I haven't been, emotionally, I feel bad about myself.
Mhm.
So I was just listening to Dr. Benton, and I was thinking to myself, like, wow, that completely relates, to this patient and to myself, honestly, because Dr. Benton has worked on me one day, a weekend before I went to a funeral, and I didn't tell him I was going to a funeral. I didn't tell him anything about the emotional trauma that I was personally going through. But as he
Yes.
was testing me and he was talking to me, he just kind of brought it up like, hey, what are you doing this weekend? What's been going on this week? What's been happening with your life? And, I kind of sort of had to finally break down and say, I'm going to a funeral tomorrow. It was a really close friend of mine. I didn't really get to talk to her. And, after that process, he really helped me heal emotionally. And I didn't even see him for that. I went to see him because I had neck pain and back pain and leg pain. And I was like, no way, I can't go to work this way.
Yes, most
So,
definitely. And a lot of people are not aware that these subtle energies, and they're not subtle because they affect you as a human being and not knowing. One lady came in the other day and she said, well, my back is hurting. I think I stood up the wrong way. Well, there are some mechanical things, but what was on your mind? What were you going through when that even happened?
hmm and like this patient, Michael Ochenero, he had no idea, that what he was feeling internally was really affecting what he felt physically. And, it
Yes.
happens every day, every day. And like how Dr. Benton mentioned, off of the small, minor things, your friend pushing you off the curb, a small car accident, it just affects our bodies so tremendously.
Or people that owe you money and won't pay you back your money. I,
Right.
I, I spoke about that before, and you're around them all the time. It's like, well, why is it they won't pay me back my money? Or people borrow things and they don't return it. And, there's a lot of little things that can cause a reaction within the body itself. And it's wonderful. There's simple techniques that help a person to overcome and to heal.
Yeah, it's definitely amazing. And Dr. Benton, he does some incredible work. I can tell you, I went to that funeral and I was really ready, to let go and to forgive myself for, whatever I was feeling in regards to my close friend. So I just wanted
Yes.
to put that little insert in there so
Well,
people can
that
kind
was
of make a better
wonderful.
connection of,
Thank
the
you.
emotional and physical.
Right. Thank you for
Okay,
sharing that. That was wonderful. Thank you for sharing that.
no
And I
problem.
and I know a lot of that is going to help our listening audience also. And I'm hoping that on June 15th, you can come here to the clinic at NutriMed Integrated Healthcare. Dr. Benton is going to be here. We're going to be doing some wonderful things. But again, we will be giving you some techniques on the air here today so you can get started yourself.
Okay,
So
that
if you want
sounds
to give
great.
us a
I
call
will.
here at the clinic, it's 310-419-4300. And just in case you want to share this show with your friend, you can go to the Cherilyn Lee Health Show.fm and go to YouTube, and this show will be posted there in about another, probably by the end of this week, it will be posted there. So you
That's
can,
right.
email and send this show out to your friends or have them go to the Cheryl Lee Health Show.fm and
Hmm.
go to YouTube, and the show will be posted there because it's so important we're able to help each other on this planet.
Yeah, it
That's
is.
right.
If any of the other listeners out there, they want more stories to relate how the emotional pain and the physical pain connect, I know Dr. Benton has a lot of stories like this on his own website, lighthc@gmail.com. So if you're ever really, confused, I'm not sure if this relates to this, you should definitely go on the site. It really does help.
Right. He's going to give out all his information near the closing of the show. So we're going to now be able to give these some more techniques because there's just too many people. And you know what's going on in the media, and we see what's going on, and it's heartbreaking to see these things going on. And a lot of people that are here in California, because that's where we're based, have friends in these other countries, and I mean other states. And other states are listening to this show because it is internet. So we want to be able to help others also through this journey.
Yay! Thanks for taking my call, Cherilyn. You're doing a
Oh,
great job. I love
thank
your
you.
show.
God bless you. Thank you very much.
Bye.
Bye bye.
Terrific call there. That's wonderful.
Oh, that was they the person she spoke about, he does real estate. He's a real estate a realtor. So a number of those projects were deals that were not coming to fruition, and they turned around. So he was able to help manifest more prosperity for himself.
Wonderful.
And so,
And
I
I
just don't know
think
how these things are connected. Yeah.
I know. I think we have another caller, area code 5541.
Yes, my name is Rebecca.
Oh, Rebecca, thank you so much for calling. Um, Thank you so much for calling. Um, you have a question or
Well,
comment?
I actually wanted to share an experience that I had with Dr. Benton. My mother and I went to see him for some trauma that happened in our family, and I wanted to share that with the listeners.
Wonderful. Please do.
And it's still a little emotional, so I just excuse me. So in my past, my family has had some sexual abuse trauma, and my mom felt extremely guilty for she said not protecting me, and so she really wanted to do a session with Dr. Benson, and I kind of got caught off guard when she said, "Come on, let's do this." It was a little
Yes.
uncomfortable.
Okay.
and so we went, and she had never really fully expressed to me the pain that she had felt, and the session that we were able to do with Dr. Benton helped to release a lot of that pain and miscommunications, because I think a lot of people aren't able to fully articulate what's going on with them or how that pain has affected them, and then that gets stored in the body. And after the session, my mom and I, our communication improved, our relationship improved. We were able to talk about the situation and what had happened in more of a way than we had ever previously been able to do. And I think that also, created some healing between my sisters and my brother, because it had affected everybody.
Yes.
And so it was just amazing how you can help to release the emotions. And then I know my mom shared with me later on that she had, lost some weight. And so a lot of this was holding her back in ways from keeping her from being her best self. And it was just amazing to me how we were able to be closer and have better communication and have better understanding of where everyone was, instead of hiding that pain in our family. So it was just an amazing experience, and I hope that Dr. Benton can help others.
And what you just shared, I really commend you for being able to have the courage to come on the air and share your story, because there's a situation that I know of personally, of a family member who was molested by a family member. It was a female molested by her brother. And unfortunately, when they approached the mother just said, later in life, the mother just said, don't worry about it. That was the past, and we'll just pray about it. And would not embrace the daughter, would not embrace the child, which was an adult now. And unfortunately, because they never cleared it, and the mother became very ill and passed, the daughter is left with all this bitterness and stage 4 cancer now. So you're telling this story today. I hope this never have to happen to anyone else, because they never had a chance to talk about it and to release this. And now the daughter is ill, the mother has passed on, and it's still uproar within that family structure. So you're sharing this. I know it's going to help heal a lot of people and a lot of homes. And I really, really, Rebecca, appreciate you sharing this journey, and bless you. God bless you.
Thank you so much, Dr. Lee, and thank you, Dr. Benton, for helping my family.
Thank you. Thank you for calling.
Wow.
That was powerful.
Yeah, that's I think kind of left us all in a little tears here, because
Yes.
I just appreciate Rebecca sharing the story. I really do, because the other person, the other party, did not, and the mother did not, say anything, which left the daughter very painful, very hurt toward everyone, and to the point she totally just isolated herself, and she has nothing to say or communicate with anyone, and which is really sad, really, really sad. And now that she's in stage 4 cancer, it makes it even worse.
Right. Well, maybe your patient is listening, and maybe they'll have a change of heart. Maybe this program will help and say, I want to let go. Because, as long as you're alive, I think there's a chance. But
So do I. So do
yeah,
I. And so I pray this person is listening. And but I spoke to, I know some of the people in that family, and this person will not communicate with anyone.
right. And
But I'm praying, prayer works. So
prayer works.
I'm going to keep praying that they will. So, I'm hoping that listening to this journey, that people will seek out your technique, that what you're doing to really help. And people have to come in with a willingness, to say that I want to make this change, that I want to let go, I want to forgive. It's very important.
And a lot of people, it's just having the willingness, because the universe will find a way. Just having a willingness to forgive, because some people are just really afraid. Sometimes they're willing, but there's this sensation that blocks their heart, and it seems like it's very, in fact, it's almost dangerous. It's very fearful. It's very dark. But in truth, it's just the dark covering, not allowing the light to come through. And sometimes you just need, let someone hold your hand through it. So at your office, absolutely, or here at my office, just
Yes,
nurturing them
exactly.
through, and we'll help you through it.
Yes,
So sometimes it seems like it takes forever, and it doesn't. You get through it. I guess the 2 callers that called in, I think I just had 1 session with each of them. It doesn't take long to do a tremendous amount of healing. It just takes a lot. Take some compassion, and the willing to, in a way, stop the world so we can hear your pain and acknowledge it and help you release it.
so our time is moving pretty rapidly. So I
Wow.
want to still
Okay.
be able to give some techniques so
Okay.
people can use at home. Yes.
Okay. So, all right. Let's talk about some technique, and they're simple and profound. So I was talking about this technique, and I call it shock trauma. So there's emotional trauma, and there's shock trauma, and which is another way of saying that physical trauma. And so for the listener at home, if you have a shock trauma, think about that event and take a breath in. Inhale as you tilt your head back a little bit, and then exhale and bring your head forward. Do it.
Now you want to be sitting down, right?
You can be probably better if you're sitting down, but you can be standing. It doesn't
Okay.
really make a difference. But you just think about the event and take a breath in and exhale.
As you're
And
bending
then
your head forward.
bending your head forward. Yeah.
Okay.
And you don't have to do it. Excuse me. You do it twice. Once with your eyes open and once with your eyes closed.
Okay.
Okay. And then if you have an emotional event and if you feel like you can sort of feel where it is in your body. So then do this. You put one hand over the body part, usually the heart, sometimes the lungs if you feel like a tremendous amount of grief. By the way, grief is the emotion associated with the lungs. So put one hand on your lungs. Put
Okay.
the other hand on your forehead. And the forehead is where your emotional reflex points are. Let me explain what I mean. like if someone is worried, oh my goodness, how am I going to take care of this problem? I don't have enough money. Oh, of some problem. Where do they touch? Like whenever you're worried, do you touch your elbow? Do you
Nope.
touch your foot? You touch your forehead.
Yes.
You put your forehead. That's where the emotional reflex points are located. So you have the person hold on to maybe the body part that hurts or aches, and they put their other hand on their forehead, and then take a breath in, tilt your head back, exhale, bring your head forward. Do it once with your eyes open, once with your eyes closed. While you hold these body points and think about an event, it should lighten up a bit for you. In fact, hopefully maybe you'll have some listeners do that. Maybe they'll call in, because I know the time is short, or maybe after the show they'll give you some feedback of how that works for them.
Okay. Well, I just did it while we're going through this process, and I actually feel a little lighter. Belinda, how are you feeling?
Same here. It's
Isn't it magical?
lighter, like a little looser there. The muscles are loose.
Right. It'll just it's an amazingly simple technique, and
Very
the way
relaxing.
I describe it is like it takes the splinter out, the energetic splinter out of the situation. Whenever you have a splinter in your finger in your body,
Right.
it hurts. But once you take the splinter out, it doesn't hurt as much, and now the healing can happen. The healing can
Okay.
happen faster because it takes the energetic block out of the way.
So this doesn't matter if you have pain in your abdomen. You always want to ground one hand or take one hand and put it on the forehead, and then take the opposite hand, you only have two, and place it on the area of concern. So if it's your knee, your thigh, your stomach, even if it's your eyes, because I have a lot of people who have eye conditions and glaucoma, and there's some emotional ties to why they have the glaucoma. There's always the physical, with open and closed angle glaucoma, there's going to be a physical, but there's always an emotional too.
Right.
So they can also,
It's usually together.
yes.
Usually, and look, whenever I'm driving down the street and someone cuts me off or whatever, and then I just remember, I got it. I need to take my breath in. I go, I do
Okay.
it, and then we're done.
Okay, but you don't close your eyes while you're driving, right?
No, I don't. Well,
Only at a red light, right?
at a red light, so I'll wait at the red light there.
Yeah, do it quick enough at the red light.
Right. But
I just have to throw that in.
see
Okay.
how quick. Yeah.
Yeah.
It's a quick, effective tool to lose some trauma. Just let some of that trauma drop off your body. It's amazing.
No, you just do this. I don't know, how often would a person do this? Would you do this every day?
Well, what you do is, I think you do it until that event sort of dissipates on its own. So two things. If it's an advanced case, well, then maybe I need to see somebody, and we need to work on some, the deeper underlying issues that are still there.
Yes.
But you can actually think about some event that sort of happened that sort of has your attention, and then do this little technique, and then come back and see if it's better. And then if we take that energetic splinter out, it should start dissipating on its own, and then maybe you repeat it a few hours later or the next day, and it should clear away on its own.
That's very good. So
done.
what happens with the physical component of it? So if you're having knee pain or, you have pain in your abdomen, you definitely want to check that out and see what else is going on with it. But to do the emotional component first, you can do that on your way to go have the physical component of it sort of checked out. So how or will the pain subside also? Or would the vision become better if it's glaucoma?
Well, I don't want to go into legends. I don't know exactly because I haven't worked on many glaucoma patients.
Okay. Well, I have several, and I'm going to definitely
bring them
have
with you
them
to
start
the
doing
clinic.
that.
Make sure they're at the clinic on June 15th.
Okay.
We'll find out.
and we definitely will, and we'll get back and have a follow-up show and have a videotape showing people what site to go to and see all these
Wonderful.
wonderful techniques and the healing that's happening with other people. I think that's going to be absolutely wonderful. And now we have less than probably 8 minutes left for the show, less than 8 minutes. So in a nutshell, Dr. Benton, because I don't know if you have other techniques you want to share, but I want to make sure we get as much stated on this show to help our listeners as possible. So we have less than 8 minutes. And what else would you like to?
Um, I think we sort of covered what I wanted to share with your listeners and something that I can share with them just listening. Maybe in the future show there's some advanced points to work on, but they deal with different acupressure points on the face, and we really probably should videotape that portion of it because I need to describe where to put your finger in different parts of the body. But the step one is what went over with you right now. Hold on to the body part and then take a breath in and out, eyes open, eyes closed. Eyes open is more for the conscious self. The eyes closed is for the subconscious self to clear both conscious and subconscious.
Oh, that's really interesting. So repeat that again, a little bit slower, and let's go through the whole technique again. Eyes
Okay.
open, eyes closed, tilt your head, bring the head forward. So let's take them through that. And what you just stated for why your eyes are open and closed, that was pretty powerful. So let's kind of take them through that. So at the end of the show, they really have a good sense of doing this.
Absolutely.
Thank you.
So if you have, I call that a shock trauma, so someone pushed you or the body part hurts you, you can hold on to this body part, maybe your neck, and just take a breath in and tilt your head back. You just have to tilt it back a little bit. You don't have to tilt it back all the way. Just tilt it back, 10 degrees a little bit. Tilt it back. Exhale, tilt it forward. And then close your eyes and do it again. Tilt your head back and tilt your head forward. That's for the shock trauma. For the emotional trauma, let's say you hold on to the same body part and now connect it by holding on to your forehead with the other hand. So it'll connect anything that's in that body area with an emotional issue, and do the same thing with your breathing and tilting your head back with an inhale and forward with an exhale.
Wonderful. And say that again, too, with the eyes open, closed.
Oh, okay.
What that really means, because that was very good.
So having your eyes open sort of deals with your conscious self, and then you do the same thing with your eyes closed. And the reason I have patients close their eyes because it's for your subconscious self.
Subconscious. And can you kind of explain that a little bit, just a little bit?
Absolutely.
So your conscious self would be what? Give an example.
Our conscious self is, so whenever you're awake, you're looking, you're seeing, whoever you're speaking with, you're driving, whatever you're conscious of. But right now, as your listeners are, and you and me are sitting and talking, our unconscious self is all the other things that are going on in the body. If we're still digesting our late breakfast, or we're sitting in a chair, our heart is doing its job, it's pumping, our kidneys are doing their job. There's a lot of stuff that's going on that's not conscious. We're not aware of it, but it's still going on.
Yes.
And
yes.
We have to acknowledge that because these emotions, these emotional triggers are going on subconsciously. We're not aware of them, because if we'd be aware of them, we wouldn't want them. We'd want to get rid of them. But the body needs to store these traumatic events, and it becomes part of our subconscious self. In fact, we'll probably maybe talk more about that in an upcoming lecture or at your office about the subconscious self. And I know we're running out of time. One more little piece to add, if possible, is whenever let's say you touch the right side of your neck and you do the technique, this breathing technique, then go and touch the left side of your neck and do the same thing.
And this is with your hand on your forehead, right?
With your hand on your forehead or your hand off your forehead.
Okay.
One thing thing, and I'm going to touch upon it now and apologize, and we're probably going to have to explain it more later because we're running out of time. I find that these emotional traumas, the body tries to dissipate these energies as best it can. And the body dissipates the energies by it's like putting it on two different parts of the body. So if you like slice your body in half, you have the right side and the left side. So if you have a pain on the right side of the neck, do the technique also on the left side of the neck.
Okay.
It's how the body tries to dissipate energies, and I apologize for throwing it in at the very end here. I just thought about that. That's what.
Yeah,
I
well,
do
the
in
body
sitting
would try
office.
to compensate. It would try to compensate if you have pain on one side. You got to start pulling more on the other side to compensate for the pain.
And
So
yeah,
that makes a lot of sense to touch both sides for the
mm-hmm.
healing. Mm-hmm.
Do one side and then do the other side. I generally don't do it at the same time. I do one side, then I do the other side.
Yes.
When I do the advanced work on patients, on what they want to manifest, we always do one side and then the other side. And I go back and forth until the muscle test is strong.
Wonderful. Wonderful. Well, this is great. I'm praying that our listening audience, and I know we have a lot of people listening and a lot of people at work, so a lot of times they can't be emailing questions um, but I do have a lot of questions, not so much questions because we covered so much, but I have a lot of emails actually since we've been sitting here saying thank you so much for this show. That has been really helpful. So this has been absolutely wonderful, Dr. Benton, and I just thank you so much for taking the time out of your schedule today and joining us for the Cherilyn Lee Health Show. Thank
It
you
is
so
my
much.
pleasure to help you and your listeners. You are such a wonderful light to the world. It is an honor. It's just an honor to know you and to be with you and to be on your show. I thank you for the amazing work that you do.
Well, I'm
You're a
grateful.
magnet for miracles.
Thank
Oh,
you.
that is
Oh,
wonderful.
thank you so much. And that's my closing of my show.
Oh,
To always say that. So we're going to repeat that because we are closing now. Thank you so much. Repeat after me. I am
I am
I
so
am
grateful
so grateful
that I am
that I
that
am
I am
a magnet for miracles. And please
a magnet
continue.
for miracles.
I'm sorry. Please continue to send us your miracles after saying this on a daily basis. We do have a lot of emails where people have been sending their miracles that have happened in their life. And we're going to have a show and just share those miracles because they are absolutely wonderful. So please say this. Gratitude is very healing. Be grateful for what you have right now. Sometimes we pray for other things and want other things. Be grateful for where you are right now in this moment.